Thank you to the Department of Health and NB-IRDT for the opportunity to present. This is a topic that is really important to me, and thank you for my co-researchers for all the really hard work that they put into this research study. This is really important to me because when I first moved to St. John and started here at the regional hospital about 8 years ago, I learned about this program and I thought this is quite an amazing partnership. I'd never seen anything like it in all of my training. And so we decided to study it and share it in the hopes that our model that we have here might be able to be reproduced in other programs in other cities. So, all right, next slide. All right. So modern breast cancer surgery is really quite well tolerated by the vast majority of our patients. And as a result, outpatient surgery is really quite well accepted as a practice for patients that are having lumpectomies, mastectomies, and even sometimes with immediate breast reconstructions. And so what happens with outpatient surgery is patients come into the hospital in the morning, they have their surgery, and then they get to go home at nighttime and sleep in their own beds where it's quiet, they can recover well. Outpatient surgery benefits patients and the healthcare system as it minimizes time away from home. It reduces the costs for patients, wait and the hospital system. It reduces wait times and it reduces stress. How it reduces wait times is that we don't need to wait till there's beds in the hospital because patients can go home that same day. The criteria for outpatient surgery depends on the patient's age, other medical comorbidities, family support, and the distance that patients live from the hospital. And specifically in our case, the distance is the crux of the situation. So we recommend that patients be close to the hospital, and specifically as close to hospitals with surgical capabilities in case there is an early postoperative complication such as a bleed that they need to go back to the operating theater. So it's great that patients have access to hospitals that have other care, but if you don't have an operating room, then that's not very helpful. So that makes it difficult for patients that live far away from the hospital that might have difficulty accessing emergency care in case they run into those early postoperative complications. Patient hotels and similar accommodations have been gaining popularity across Canada. They alleviate the capacity demands and support outpatient care by reducing unnecessary hospitalizations. And this leads to cost savings in comparison to traditional hospital stays. This results in better patient satisfaction and positive health outcomes. So what this does, our program, it blends healthcare and hospitality to provide patients and their families and friends with the support that they need for healthcare and rehabilitation. Next slide. Beautiful. So in the past, patients were typically admitted to the hospital following breast cancer surgery, all breast cancer surgery, okay? And then outpatient surgery started to become offered for breast cancer patients. Now, rural patients were not necessarily able to take advantage of this, such as if you live in Grand Manan, Campobello Island, right? That's a long commute, and that would be very, very difficult for those patients to get back to St. John Regional Hospital if there's any problems. So since 51% of New Brunswick's population resides in rural communities, many patients were forced to stay in the hospital, especially and with risk of things such as hospital-acquired infections such as COVID, that would be sub-ideal, or they would have to pay out of pocket at a hotel nearby or travel long distances before getting home. So in 2000,
sorry.
Oh, absolutely. So in 2006, the breast health program and the Delta Brunswick Hotel developed the Delta Oasis program to give rural patients a one-night free accommodation, including meals, parking, and extramural care. So we investigated their experience from 2015 to 2020. and we quantitatively explored the effects of the program on patients' perioperative anxiety and their recovery quality. We looked at the patient satisfaction with the program and its impact on the perceptions of the Delta Brunswick. We conducted semi-structured interviews to understand patients' experiences. And then finally, we also engaged patient partners in the data synthesis phase.
Now it's actually me. I'm Sarah Burgess. I'm a research coordinator at the Maritime Spore Support Unit. So nurse navigators would identify patients who are eligible for the Delta Oasis program based on their discharge disposition and how far away they are living from the surgical treatment center, which is 100 kilometers away. And then patients are given the opportunity to participate in the program, so they don't have to choose to go to the Delta if they would rather go home. So for the current study, patients who chose to utilize the Delta Oasis program between 2015 and 2020 were identified and contacted by the nurse navigator, who informed them of the survey and project and asked if they'd like to participate. And then to understand the differences, if there were any differences between preoperative anxiety and recovery, we also used a control group of patients from Moncton who underwent breast cancer surgery in the Moncton Hospital and then were subsequently discharged home, which would be about 100 kilometers away for them as well. So in the same instance, nurse navigators in Moncton contacted these patients and asked if they'd like to participate. So we did surveys that consisted of a demographic questionnaire and then their clinical history on diagnosis, survey, or surgery type. And then we were given, gave the patients 2 standardized questionnaires, the preoperative anxiety visual analog scale and the postoperative quality of recovery scale. These have been previously validated for validity and reliability. And then patients who used the Delta Oasis program were also given an experiences questionnaire where they answered questions about how the experience was for them. And at the end of that survey, they were offered the chance to have an interview if they would like. And if they said they would be interested in an interview, we would gather their contact information for that. Semi-structured interviews were conducted over a period of 8 months by myself, and all interested individuals that indicated they were interested were contacted, but we had 17 people actually complete the interviews. I underwent some qualitative research training with a member of the Horizon Health Network research team, and used a semi-structured guide to ask questions on how their experience went, how they felt before and after their surgery, and just overall thoughts about the program. These interviews were then audio recorded and transcribed verbatim, and we uploaded these to NVivo to then analyze the data. So through analysis, we myself and the member of the research services office coded everything and came to a consensus on all themes that we found within the data. Both the results of the quantitative and qualitative analysis were brought forward to the clinical team, as well as 2 new patient partners that we added on at this stage to help us interpret the findings. So one of our patient partners had their surgery in St. John and then participated in the Delta Oasis program following their surgery. And then the second one actually resided in near Moncton and had their surgery in Moncton and were discharged home about 100 kilometers away at that time. So both participants or both patient partners actually participated in the survey, and we had our nurse navigator reach out to determine if they would be interested. And then we had meetings with the patient partners and the clinical team to interpret the findings and really make sure that we had a true understanding of the discussion and of all of the information that we gathered with the surveys and interviews. So for our surveys, we ended up with 34 patients from St. John, most of those having a mastectomy, and 18 from Moncton, with, again, most of those have had a mastectomy. We did have 19 participants who indicated interest in an interview, but we could only get a hold of 17, and we interviewed all 17 of those patients. So some qualitative analysis. The main finding, and the one that we saw the most often with everyone, was that the program was positive. People were really pleased with how the staff at the Delta treated them, how accommodating they were. They said, at one point, a patient had their husband with them, and the staff actually brought the husband a glass of wine just to be nice. So they were really pleased with everything about the stay. They felt that it was a really nice, relaxing time, and a break from their daily routine. Some people said, I wasn't home, I didn't feel like I had to clean up the cat box and different things like that. And then everyone really loved the food and accommodations. Some people were really pleased with having their family with them. Some people actually had multiple family members purchase hotel rooms near them so that they could have a whole support system on that night. But they were really pleased that everything that the patient got, the family member that was with them also got. So there was 2 meals included, not just one. The Delta staff were accommodating to both of them. And as patients, they were often talking about how they felt bad for their spouse or their family member for having to sit around the hospital all day, and that they were really happy that they got to go to the Delta and get that treatment as well. A lot of people, especially those who had their surgery near the winter, were really happy to not have to drive that 100 kilometers home. A lot of people were saying how if they would have been thinking, the whole day before about having to drive in a snowstorm, or what's the weather going to be like, how long am I going to be there. So that took that added stress away from their day. They really liked being close to the hospital. Everybody really was speaking very highly of the surgeons and the nurses at the hospital, and they were really happy to be there with them. A lot of people were really vocal about their wants to be near the St. John Hospital where they had their surgery. So it was really reassuring for them. And then, of course, they really liked having that follow-up care the next day from the extramural nurse before they went home. So the extramural nurse would come in, let them know, yes, you're okay to drive home. And they felt that was really reassuring. We also asked participants directly if the program had an experience on their surgery or had an effect on their surgery and recovery experiences. And 13 out of the 17 said that it did have a positive effect on those experiences. And we also asked if there would be any improvements to be made. And 10 said no, nothing to improve, it was perfect. But a lot of people actually said it should be expanded to other regions and other types of surgery. A lot of these people also indicated, different types of surgery that they've heard people go through, that it would be really important to have this kind of a program with that stay, especially if they're being discharged home. Finally, just some healthcare related themes that we uncovered were that the recovery went well. Everybody, or most people, said, no problems, it was great. They had, as I said, mentioned earlier, really positive experience with healthcare providers, going right from, the surgeons and physicians down, like the nurses and everyone that interacted with them on that day. They really felt that team was what made the surgery go as well as it did. People were often emotional about their cancer diagnosis and surgery. We started the interview with just tell me about your experience, and that's what a lot of people really brought up. And in those same veins, they'd often bring up that while they were emotional, it was really nice to just be treated well at the Delta. So it was that balancing act between being really emotional and just having something special. A lot of the rural patients, though, were used to traveling for healthcare, when we asked, like, how was it to travel, they said, oh, we do it. It is part of our life, living out here. So that travel, while the day of the surgery they didn't want to do it, was otherwise just something that they accepted. And then a lot of people just felt okay about the surgery. A lot of people said, it was what it was, and I was just doing what I had to. So they sort of had come to terms with that.
Thanks, Sarah. All right, just moving on to the quantitative results. All the participants, except for one, stayed the night of their surgery, and several also even stayed the night before, which makes a lot of sense, because you know what, you want to be on your game the day of surgery. Just get your head into the right place, right? On top of that, occasionally people need to have a procedure the night before their operation to prepare for the surgery. So I suspect that's why people stayed the night before. The quality of sleep that patients said they had was fair to good on both nights. Most participants took advantage of the complimentary dinner and the breakfast, and they remember it being pretty good. All of the participants were accompanied by someone, usually a spouse or a partner or family member, and no participants reported any health problems during their stay. So no returns to the emergency department were reported. Perfect. All the participants, except for one, indicated they were likely or very likely to recommend this program to others. Most participants indicated that the program actually increased or greatly increased their likelihood of staying out the Delta again in the future for non-health related issues. And their experience also increased their likelihood of recommending the hotel to others. Okay. So the results from the analysis of variance tests did not show any difference between the Delta group or the control group on the perioperative anxiety or quality of recovery. And we did have a small sample size, but the descriptive statistics also suggested that there was no significant difference. So this did not make things worse. All right. So what are the implications of our study? This shows that there was a high degree of satisfaction reported about the program by the program participants, which is consistent with other reported patient hotel experiences. Patients appreciated having their family members at the hotel post-op, and this is also consistent with previous studies. This program helped to reduce the burden of care often felt by family members of breast cancer surgery patients. This is because time spent traveling long distances for appointments and procedures puts a strain on family dynamics, since a lot of the times it's women that have the disproportional carrying of the load of the care of work. So further partnerships between our healthcare system and hotels such as the Delta Brunswick could lead to future healthcare savings. What are our thoughts on future directions? We would really love to expand upon the current study by conducting prospective analyses of the cost benefits and the patient experience associated with the Delta Oasis program, and investigate potential opportunities for expanding this program to include other low-risk surgical cohorts and across provincial health care zones. Finally, we would like to partner with Indigenous communities across the province to assess breast cancer surgery-related needs of outpatients, with the goal of implementing culturally supportive accommodations through the Delta Oasis program.